the fast, we just slows down. We just simply skip that. If you are issue with microbiology, if you have issue with some subject, you should give time to that subject. It is rather to just stop taking lectures like that. I will just say, okay, let's start with observational studies. So, observational study, okay. So actually, in this biostat, we will study different type of issues. Okay. So when you are performing some study, you can have actually, okay, you can have, okay, okay, you are when you are performing study, you are doing case control, you are doing cross series, you are doing cohort study, you are doing randomized control trial. You will have issue with them. Okay, so performing study, so you are having observational study. When you are evaluating, okay, your study, okay, you will do type 1 error, type 2 error, you will do confidence interval, you will do okay, bias, confiner, ANOVA test. During evaluation your study, you will do such type of issues. Then next is the you are applying study. When you are applying some study, okay, so then you use sensitivity, specificity, positive predictive value, negative predictive value, likelihood ratio, incidence, prevalence. So that's it. So today the topic we are covering, okay, so these issues, these studies will be occur during your when you will performing your study. Okay, when you are performing your study. Let's start with the first case. The first one is a case series. Okay, describes several individual patients with same diagnosis, treatment, or outcome. Here, case series, it is just descriptional study. You are just describing the disease. You are just describing the disease. Okay, you are just give the description of your study. Okay, so here description of clinical finding and symptom has no comparison group, thus can't show risk factor association with disease. So here there is no control group. You will just define your actually you will define your disease. Okay, so for example, a COVID case come, you will just say, okay, so these are the sign and symptom of COVID. Okay, it affects this population. Okay, it affects these ages of population like that. So you are describing some study, describing some disease. That is case series. Okay, most of the time case series are done in the case of epidemic or pandemic. When the pandemic epidemic come, you give description of your disease, description of your health issue. So that is called case series. You are just describing your disease, no control group. Okay, it identify only disease group, document patient response to treatment or progression of disease. That's it. You will okay just describe the disease, sign and symptom, okay, which area is affected, which population is affected, which age group is affected. Okay, and you will show patient response to treatment. Like in the case of COVID, okay, so some treatment response to dexamethasone like that. Just describing the disease. Okay, no control group. That is case series. It is purely descriptive study. They often use a new disease with unclear cause. Okay, multiple causes of condition combine and analyze according to patient demographic description like age, gender, and according to symptom. Done to look for clues about etiology and cause. No control group. So that is case series. Okay, now I have defined all about case series. Okay, so remember descriptive study. Okay, it is for new cases, new disease. Okay, that's it. So here you can have example. Okay, for example, I will say, so I have given you example of COVID. affect this population, originate from China, have flu-like symptom, respiratory distress, and this age group is affected. Okay, and then what are the sign and symptom? Okay, so we'll just try to look for clues about etiology and cause. We have not discussed there is another group that is a control group. We are not have comparison. Okay, so that is case series. You are in one word, I will say in one word, description of disease. That's all. Then is cross-section study. Cross-section study is just snapshot of time. We are just see the disease prevalence. Like here, common example is given in New York. Okay, 80% population have pneumonia. Okay, 20% have no that disease. So that is just cross-section study. You will just took the cross-section of some area. Okay, and you will check about disease prevalence. Okay, here in cross-sectional study, very important point is that you will have absence of time period. Patient not followed for 1 year, patient is not followed for time. You are in just at one time, you will took the, you can say snapshot of time. Show only prevalence, cannot find risk factor, can have more than one group. Here you will have lack of time frame. Guys, this is most high yield point for cross-section study. You will have lack of time frame. This is very important point. Okay, how many smoke, how many have lung cancer. So, अरे ओ सांबा कितने आदमी थे? Even that is a concept. Okay, how many smoke, how many have lung cancer. Okay, so that is a cross-section study. Frequency of disease and frequency of risk-related factor are assessed in the present. Ask what's happening. Okay, so most important one is that cross-section study will you tell you about disease prevalence. So, for example, okay, in New York, in 90, okay, in New York in 2020, okay, so there was 50% population smoke and 25% population have lung cancer. Here I have not tell you that okay, we have followed the patient for 1 year. Okay, here there's no time frame is given. Okay, I am just telling you what's happening, how much, how many people have the disease. Okay, so that is cross-section study. Can show risk factor associated with disease, but does not establish causality. Here I have told you that okay, 50% population have smoking, and 25% have lung cancer. Okay, here I have tell you risk factor like smoking associated with lung cancer, but I have not established the causality. Okay, so that is cross-section study. Here, in one word, you can say that it is a snapshot of, okay, that is a snapshot of time. In one time, you will just see how many, how much the risk factor is present, how many people are affected in one time. So that is disease prevalence. Like we will say, okay, in Pakistan, or 70, okay, almost say 51% people population have diabetes. So that is snapshot of time. That is cross-section study. Patients are not followed over time. So that is cross-sectional study. Okay, done. Next is the case control study. So guys, these observation study are not okay, are not so you can say in any exam, one or two MCs will come from this observation study. Okay, so don't take them light. These are very high yield. Next, these are the two very high yield study. One of them is case control study, other is a cohort study. Okay, now first we'll study the book, then I will give you the different clues to identify case control study. Okay, so case control study, it is the retrospective compare a group of people with disease to a group without disease. So first of all, that is the main difference between case control and cohort. In case control, You will took disease people, that will be termed as case, and healthy people, healthy population, that will be control. First, you have made two group, case group with disease, without group. Okay, other is a group without disease, that is control. Then you will compare the odds of prior exposure to risk factor. For example, in the case of lung cancer, I will took the patient with lung cancer as a healthy population. Then I will okay, I will go backward in back in time and see lung cancer population, lung cancer people have smoke, how much smoke, how many cigarette per day, like that. Okay, I will go in back. That is called retroceptive growth. Okay, we'll go in back in time. We'll compare the risk factor between the disease people and without disease people. Ask what happened to them. Okay, so in case control study, you will do the odds ratio. Okay, in the next tomorrow we'll see how to calculate the odds ratio. Control the case in the R. Here the mnemonic is given patient with COPD. Okay, so you will took the patient with COPD and patient without COPD. The patient with COPD will be okay case group. Other without COPD, there will be control group. So then you will okay you have done COPD had higher odds of smoking history than those without COPD. Okay, so guys, okay, so you will took the disease people and then go toward exposure. Okay, first you took disease people and non-disease people, then you go toward their chances of exposure, how much they exposure to, okay, okay, like that. First, the main key point is disease thing will be given. Okay, a question has been asked in NVME. Okay, so the question is like that. Okay, okay, so ages is given like young adult score in USMLE, then older people score in USMLE. So that is the concept. Here, the point is given, score is a result. When the result is given, when the outcome is given, okay, and then you are comparing that with the risk factor, okay, that is called case control study. So this type of question, like score is given, okay, so average score was given in young adult, average score was 255, and other older group average score was 235, like that. Okay, so score is given, result is given, outcome is given, disease is given. That is case control study. Okay, so so that type of question can be given. Okay, if disease is given, outcome is given, result is given, and then you are comparing them. Okay, so that is called case control study. Guys, easy point. Case control study, case is disease, control is healthy, and outcome is given. Okay, that will be the case control study. Okay, that is for case control study.